highways on the reservations, and they usually go right through the reservations. So there's nothing into the communities themselves. So transportation is quite difficult. The sovereignty of nations. I pointed out last night at the round table. Each tribe in the United States, the 22 tribes in the state, have their own individual governments. They have abilities to make their own regulations within their boundaries of what is allowable within the United States. They have a direct relationship with the Congress of the United States and the federal government. And that is something that many people don't understand. And it allows the tribes to do many things that even the states are bound and tied to federal regulations. So it's a unique relationship that the tribes have with the federal government. Cultural uniqueness of Native Americans. Each tribe has its own culture. Each tribe has its own language. Each tribe have their own traditions of what they practice. They're all different. In the Southwest, we have the Apaches. Now, what do you think the Apache tribe is? It's not a single tribe. There are probably 5 different Apache tribes. It's not just Apache. You have the Mescalero Apache tribe, you have the White Mountain Apache tribe, you have the San Carlos Apache tribe, you have the Hickory Ridge Apache tribe. There are different tribes, even though you might have one. So when you say Indian, John Wayne and the Indians, remember he's not fighting one band of Indians, he's fighting a whole bunch of Indians that are of different tribes. Mortality rates, which we're going to get to, definitely are disproportionate compared to the general population of the United States. Take a look at these. And if you look down at the footnote down here at the bottom, it comes from the National Indian Health Board, which is a contracted organization of the Indian Health Service to do many of the advocacy activities for the Indian Health Service on a legislative level nationally. Numbers come from March 22nd, 2005. But look at these numbers. We have a 638% for Native Americans greater mortality rate for alcoholism, 400% greater for TB. And we thought that was a disease long taken care of years ago. Still exists for Native Americans. 291% for accidents. Sad to say, it ties in with another problem we have that's on this list. 191% greater mortality rate for suicides. Sad to say, it's our younger generation. 181% greater for homicides. 167% greater for pneumonia. 138% for gastroenteritis diseases, and 120% for heart disease. You look at these numbers, and you don't see cancer up there. And if you look at what Michelle just presented, the start of what's needed to capture for cancer data is just now starting to happen. The systems are just now starting to develop these cancer registries. And because some of the tribes are so small, it's hard to capture numbers that have effective meaning on a scale this large of when we try to capture nationally to put up these kinds of figures that people start to understand and realize the magnitude and the seriousness of some of the diseases and health problems that we're encountering, in this case primarily cancer. It's not here on our list. If you take a look at the priorities of what the Indian Health Service are facing with for the number of visits the doctors see on a national scale, cancer fits in third in that volume. But it doesn't show up on the things like this that are more meaningful. How those utilization figures come in is mainly negotiations for how much funding the Indian Health Service gets. But when you start talking about mortality figures, morbidity figures, we don't have these yet to present. Within the state of Arizona, some of these were talked about this morning, the blacks and how they fit in and the diseases they have. And you look at the Native Americans who rank next in some of their disease categories. Diabetes is up there. You talk about comorbidity. Certainly diabetes has a major influence on anything that our natives here in the state of Arizona, we have one of the tribes here, sad to say, that has the highest rate of diabetes nationally. That's just down the road from here, the Gila River community. So aside from the diabetes, and they have cancer patients, they've got tremendous problems. Influenza and pneumonia, unintentional injuries, motor vehicle accidents, and then the second highest rate for infant mortality. And again, infant mortality, something we thought that modern medicine, modern techniques, procedures, etc., would have eliminated or reduced, the mortality rates of this category. Still not happening. And that's because of many factors. And it all comes down to resources, which support facilities, staffing, training, and many things that we're talking about. Education, awareness, advocacy. Many of the facilities that operate in rural Arizona and Indian country all have primary care providers. And much of what they get involved with when they encounter a problem area are usually referred on to specialty care at your here and now, great distances, 3 to 4 hours before they can get them to a specialty care center. Hispanics are fitting in. We heard how the Asians also are fitting into the categories of diseases. So, causes of our health disparities for Native Americans: limited access to IHS hospitals. Again, going back to transportation problems. Going back to the language difficulties. Cultural differences. Lack of understanding. There was discussion in one of the presentations this morning, or just before lunch. I think it was Dr. Kyle brought this up. The doctors are just now understanding that it's the patient who has knowledge more about what their condition is, and at times they seem to be telling the doctor more about what they should be receiving in terms of care. Well, I have a mother-in-law who's from San Carlos, and she's now 92. But she rarely visited a hospital, so she finally had to go see a doctor. So she walked into the clinic, and she got into the doctor's room, and she was telling us later. And the doctor came in, and he says, "What are you here for?" And she says, "Well, you're the doctor, you tell me." And it just reminded me when Dr. Kyle says that the patient knows more about what's wrong with them. But it's a lack of communications, and that initial approach too, I was told when I was telling somebody about this, that the attitude of our providers is poor. That's just because they don't understand who we are and what needs to be communicated to open up to really understand what our problems are health-wise. Poor access to health insurance. Really there is no health insurance. The health insurance is the Indian Health Service program or the 638 programs that have been under contract or compact that's been taken over by their own tribe. Insufficient federal funding. We all know the war situation that exists and causing nationally all funding to be reduced, but more so we see that on our local level. And so whatever funding that Indian Health Service has become more and more limited. That's starting to change some, and we're starting to see some improvement on that. The quality of care issues.